Good afternoon, and thank you for tuning into this community briefing. Joining me again is interpreter Margie Prop, and thank you so much, Margie, for your services today, and thanks to everyone who's tuning in and to the media for providing coverage. We want to remind you that a great deal of detailed information is available on our website, covid19.lincoln.ne.gov. At that website, you'll also find our COVID-19 risk dial, a tool that can help our residents know how to protect their own health and the health of others in our community. The risk dial provides a visual, color-coded forecast of the degree to which there is a risk of spread in Lincoln and Lancaster County. We updated the dial last Friday to mid-yellow, which means there is a moderate risk of spread. And while this represents progress in our experience of the pandemic, we do continue to offer words of caution. We will all remain at risk of contracting the virus anytime we're out among other people. So it's extremely important that we continue to practice proven health strategies to prevent the spread. You can stay at least 6 feet away from others when you're outside your home, wearing a face mask and washing your hands frequently with soap and water. These are all proven strategies that help prevent the spread of COVID-19. And if you are in a higher risk category of folks who might contract COVID-19, it is important to try to continue to stay at home as much as possible. This is how we will all continue to protect ourselves, our loved ones, and our neighbors from COVID-19. Moving on to our public health situation report, today in Lincoln we have had an additional 34 individuals test positive for COVID-19. The total number of lab-confirmed cases in Lincoln now stands at 1,500 and, my notes say 71. 1,571? It's in conflict with our dashboard. We will get this fixed. Our total recoveries identified to date is up from 417 yesterday to 470 today. And this number is now rising more quickly, of course, since about 65% of our total cases in Lincoln and Lancaster County were identified during the month of May. And to track recoveries, our contact tracers follow up with people 28 days after the date of their lab results that were reported to the health department. So if these individuals report that they have recovered or returned to their normal health status, they are considered recovered. And again, that takes about 28 days to pass before we can evaluate that status, which is why we're now seeing a nice rise in the number of recoveries. And here with more on the latest case investigations is Health Director Pat Lopez.
Thank you, Mayor. I want to begin by reminding the public of the enhancements to the COVID-19 data dashboard. The dashboard is updated with the latest information every day around 3 p.m. It has a different look because we have rearranged it to accommodate additional data. The demographic data is now included with the new case count in the upper right-hand corner. And our cases today are at 1521 for confirmation. We have also added a new category to this section called cluster cases. You can see those. This pie chart shows that 45% of all cases are part of a confirmed cluster of 5 or more cases. Clusters are identified based on a shared characteristic between cases, primarily time and place. We have also added demographic data in 2 areas, for those who have recovered and for those who have died as a result of COVID-19. Today we have 470 individuals who have recovered. In the middle section at the bottom, you will find additional data about testing and positivity rates. This now includes daily, weekly, and overall data information. Daily numbers are good for tracking. The weekly numbers help in looking at potential trends, and the cumulative numbers provide a more comprehensive look of how we are managing overall. Today's overall positivity rate is up slightly from 7% Monday to 7.1% today. The state rate is down from 12.2% yesterday to 12.1% today. The national rate is down from 12% last week to 10.9%. An additional tab was added to the and a higher number of cases and tests. Overall, our local hospital capacity remains strong. The number of COVID-19 patients in our Lincoln hospitals is up slightly today from 24 on Monday to 26 today. 15 of those are Lancaster County residents and 17 are from outside the county. The number of patients on ventilators is 6, 4 of whom are from Lancaster County. We want to again encourage people to get tested. Bryan Health and CHI Health St. Elizabeth completed 786 tests from Friday through Monday. To sign up to get tested for COVID-19, start by contacting your doctor and filling out a risk assessment at chihealth.com or bryanhealth.com. Test Nebraska completed 1,087 tests last week. They wrapped up this week's testing earlier today at North Star High School, and they will announce plans for next week's testing later in the week. Test Nebraska is now offering testing to all Lancaster County residents. Their process also starts with a risk assessment at testnebraska.com. Remember that all testing through Bryan Health, CHI, St. Elizabeth, and Test Nebraska is by appointment only. Our health department continues to work with the mayor's office, the governor's office, and other local health departments in reviewing directed health measures. Yesterday's announcement by the governor that we will move into phase 3 starting on the 22nd of June expands capacity limits for most businesses, events, and gatherings in Lancaster County. I'd like to run through a few of these biggest changes. Capacity for child care facilities has increased for all age groups. Facilities such as gyms, fitness centers, health clubs, and spas will be able to increase their occupancy to 75%. Salons, barbershops, massage therapy, and tattoo businesses may operate at 75% of occupancy. Masks must still be worn by both the customer and employees. Bars and restaurants will be able to open at 100% capacity. However, physical distancing will need to be maintained between tables, and individuals will have to be seated unless playing games or ordering. The maximum occupancy for indoor gatherings will go up to 50% with a maximum occupancy of 10,000 people. The maximum occupancy for outdoor gatherings will go up to 75%, and that will be a $10,000 person maximum. Fan attendance at sporting events will no longer be limited to household members, and beginning July 1st, team contact sports like football and basketball can resume. Elective surgeries will be allowed at medical facilities, which will no longer need to follow the minimum requirements on bed capacity and personal protective equipment. We want to remind those hosting indoor and outdoor events with 500 or more individuals, they must submit their plans to the health department for approval. We have our application online. And to make this a simple process, an event planning application is available easily on the city's COVID-19 webpage. And just click under Business Resources. Health Department staff will review the plans and work with organizers to provide guidance for any changes that need to be made to ensure all workers and attendees are safe at all gatherings, events, and venues. As the restrictions on gatherings ease up, we need everyone to remember that anyone can get and spread COVID-19. We should all assume there is a risk of exposure anytime we are out in a public space where other people are present.
Thank you, Director Lopez. That is just an important reminder about the virus and the fact that we still do see a number of new cases being detected in our local area, and it does still have the potential to increase its impact in Lincoln. So as the directed health measures ease, we really need to make sure that we don't ease up on these common sense precautions to limit exposure and spread of COVID-19. So let's continue to support one another by practicing physical distancing, wearing face masks when around other people, and washing our hands frequently. I also want to confirm that although restaurant occupancy will no longer be limited under the next round of directed health measures, we do intend to move forward with our Dine Out Lincoln program to allow restaurants to expand their footprint to serve more customers on their property outside, to allow for additional physical distancing. Under the new DHM, tables are still required to be 6 feet from one another, and we believe that providing this opportunity as another option for restaurants will help increase the number of customers that they can serve while providing additional comfort and reassurance to potential customers who may not want to dine in but would feel more comfortable doing so in an outdoor setting. We're in contact with the state of Nebraska to confirm their continued intent to work through alcohol issues for the restaurants under the new measures, and we will keep you updated as we make progress on that front. And for those restaurants interested in moving forward, an application is now available on the city website at lincoln.ne.gov. We've had applications from 2 restaurants to date and hope that more will consider this option and evaluate it as a way to support their business as we continue to navigate life in the pandemic. It's certainly our goal to continue to innovate and embrace new ideas and ways of doing business at the city to support our community as we look to forge our economic recovery in the months and years ahead. Another sector of our community that has faced tough decisions during the pandemic is education. And Lincoln Public Schools has worked closely with our health department every step of the way as administrators make important decisions that have a major impact on the more than 42,000 students and their families. And like city leaders, our education leaders have also been doing a lot of listening to the people whom they serve, and we are pleased to welcome back to our briefing LPS Superintendent Dr. Steve Joel, who has some exciting news on plans for graduation and the reopening of schools. Dr. Joel.
Thank you very much, Mayor, and as always, I want to compliment your leadership through this pandemic crisis. It's been fantastic and very supportive for the work that we're doing. So I'm here for a couple of reasons. One is to announce that we've got graduation, physical, in-person graduation back on the calendar, and that is due in large part to the lessening of restrictions that were announced by the governor yesterday and gave us an opportunity to get with our partners to try to determine what is the safest and securest way to conduct a graduation, because we understand that this is an activity and an event that many families have built their years around, their academic years, and not having a graduation or having a substitute for graduation leaves a little bit of a hole. So with that, I'd like to thank Pat Lorenz, our interim director of the health department, and her staff for just bending over backwards and working with us to help us pull this together in fairly short form. I think we have a good plan, although we'll talk about what that entails in a second. And I'd also like to call out Tom Lorenz from Pinnacle Bank Arena, who has agreed to sponsor or to hold the graduation ceremonies. We're going to do them over 3 nights or three days, July 24, 25, 26. And we're excited about that. The schedule, very, very tentative and certainly subject to working with our principals, is Northeast will be on Friday night at 6 o'clock, Southwest 8:30 on Saturday, followed by East at 1:30. North Star at 6:30, Southeast on Sunday at noon, and Lincoln High at 5:30 on Sunday. Having said that, people have been asking why the gaps in time. That's what's going to be required to sanitize and deep clean in between audiences. I want to be very, very clear, though, that this is not going to be a traditional and graduation in the sense that we've done them in the past. Where in order to be able to do this, we've been working again with the health department, and face coverings are going to be required of all students and staff. We're going to adhere to social distancing. There are not going to be live music performances, at least not as we speak today. We're going to students will graduate in alphabetical order. There aren't going to be any handshakes. We're going to do our level best to sanitize railings, as well as students that come into contact with diplomas. The people administering diplomas will be wearing gloves. And there won't be any handshakes, of course, there won't be any fist bumps, and we're going to do our best and ask our students and our families to adhere to that. We haven't determined yet how we're going to limit the number of people that attend a graduation, but we'll be working with the health department and with our staff to determine what that appropriate number is. So we're excited to make this announcement, and I think it's indicative of the fact that our community and our county continue to take this pandemic very, very seriously, and our risk dial is moving in the right direction, and that has been our guide in our planning that we've been involved in with regard to that. So there'll be more details coming out from our communications department on our website and from your building principals regarding logistics and what we're going to do. We want graduation on that weekend to be safe, we want it to be secure, and we want people to keep in mind that we truly are in a pandemic. And as the school system, we have to do our very, very best to keep kids safe and mitigate the spread of the virus. Having said that, the second announcement that we would like to make at this time is to talk about the reopening of school. We've been working since school closed to come up with a framework that would make sense for 42,000 students and 8,000 staff and a community that believes we should be back in school. And I'd like to call up to the podium the Associate Superintendent for Business and Operations, Dr. Liz Standish, who will take you through the framework. And again, there's going to be, the devil will be in the details, and we understand that as we continue to assess risk, there could be changes, but we're very excited to announce that we're going to do our very, very best to get our kids back in school on August 12th. So Dr. Standish?
Thank you, Dr. Joel, and thank you, Mayor, for the opportunity today. We know resoundingly from our parents that students want to be back in school. And the word I'm going to use is 100% of the time, because our perception of 100% of time is full school, which means every day, all day, that we would traditionally be in school. So we recently surveyed the community on if we had to limit capacity in schools, what would that look like? We resoundingly heard from families. They want us to work hard for that full school experience for students. So we assembled a team with Lincoln Lancaster County Health Department. The health department and the school district work closely together all of the time, every year. But this is an exception. We're meeting twice a week, working through plans for reopening at school, and we are planning to have that 100% all students welcome to school for the full day, every day, in our plans for August 12th. We will conduct our framework. What we've worked on so far is what we're calling our Instructional Framework, and it is attached to the risk dial. And we are so thankful for our health department for leading with that risk dial mindset. That has given us something to hook onto and plan with. So our objective is to have students in school as much as possible, and I will share with you around the table, that's the health department's objective too. We're all working very hard towards that goal. So I'll just walk you briefly, just the highlights of the framework for the dial. So under green, when we talk about this concept of new normal, this is going to be the nearest to normal. This is going to be very near to our regular school operations with appropriate protocols put in place for safety from the health department. When we move into yellow, which is moderate, which is where our community is today, we do plan to have all students, pre-K through 12, in school. So green, we're all in school. Yellow, we're all in school, pre-K through 12, each day, every day with our regular schedule. As a part of that, we will need face coverings as a part of our protocol to reduce the spread, and we have many other details to work out. The district is currently piloting synchronous learning at our high school summer school experience. So part of our protocol in yellow, we're looking to include that experience for students to Zoom into class if there is a family that wants to make that choice. When we move into orange, which is our high protocol or rating from the county health department, our goal is to continue to have all students pre-K through 8 in school in orange, and our high school students 100% in session. But we are keeping, as a part of our planning, as a tool, the option that we may need to reduce density if we move into those high levels of orange in the high school setting. So we would look at a capacity reducing format that might be a shared schedule or a flipped schedule, and that's all still in the works. So overall, when you look at green, yellow, and orange, our goal is to have that marker of 100% students having access to school each and every school day for the full school day. In red, we do expect that that would be a circumstance where we would be moving to remote learning. The district is working to improve that remote learning over this fourth quarter, this last year, to a more live and virtual format. That's something we've been working on in the interim. So I'll just close with, that's the framework we're working towards. We know this is going to take our entire community working together to stop the spread so we can have students in school. So strongly encouraging following the directives from the health department, and what the city is asking us to do will help us accomplish this. And we know there are so many details and so many questions we have yet to work out, but we just wanted to share that basic framework with all of you today. And now I'll go back to the mayor. Yes, Mayor. Thank you for all your leadership throughout this, very much so.
Thank you so much, Dr. Standish and Dr. Joel. What an incredible challenge you have faced, and how adaptive and resilient you've had to be, along with all our students. And you know, our most precious resource are our kids, and we've entrusted them to you, and your leadership and thoughtfulness and commitment to try to make sure the resumption of school is safe is so appreciated by everyone in our community. And we appreciate all the work that you've done with our health department and with other schools beyond the public school system, because really everyone has been working together, private, parochial, and public, to try to create the solutions we need for this extraordinary time. Thank you. Finally, we want to just close out the briefing by sharing some art from children. On Tuesdays, we've been doing this as part of our Sunshine Kids for Seniors project. Aging Partners, a department here at the city, has been helping children connect with homebound seniors by sending notes and artwork. And again, if you or your family would like to participate, you may send scanned notes and artwork. Please limit it just to your first name only if your children sign the art, to sunshinekids@lincoln.ne.gov, and we will make sure that that reaches someone who would really appreciate that boost to their spirits while they're at home. And with that, we'd be happy to open up the briefing for questions. We do still have LPS here with us to respond to any of their announcements or questions about those as well.
Riley Johnson. I'll start.
Hi, Riley. Hi, Riley.
Hi, I just wanted to clarify, Mayor, did you get the number on the total confirmed
Yes,
cases?
yes.
Is it 1521 or
1521, the
17?
dashboard is correct. Yes, thanks, Riley. My notes were wrong.
I have a question for Steve Jewell.
All right, we'll be right here.
Yes.
Hi, it's Chris Dunker
Hi,
from the
Chris.
Journal
Hi,
Star. So can you walk us through, yesterday you put out this plan to do kind of this drive-through graduation that would, in late July, that would be on TV the next day. And that announcement came out a little bit after the governor had announced that he was loosening some of the directed health measures and kind of increasing capacity for some of these things. So I guess, can you walk me through what was the conversation like after that came out and leading up to the change made today?
Yeah, so we had been working on graduation, quite frankly, for the last couple of months, and made the decision a week ago that we were going to have to go to virtual and that drive-through. And that was based on the health directives at the time. That was based on our information. It was based on recommendations that we were getting from staff. And so, yes, we had planned that release. Didn't fully acknowledge what the governor was saying yesterday in his press briefing, and that once we had a chance to analyze it, we heard from an awful lot of parents this morning, as well as students, and we thought, if in fact we are going to a less restrictive environment, does that give us an opportunity then to do something different with graduation. We contacted the health department, who have been, again, as both Dr. Stanish and I said, just wonderful to work with. And we put our heads together to figure out what can we do in this less restrictive environment. And so right around the time that, I don't know, mid-morning, 11 o'clock, and again, Pinnacle Bank Arena came forward and said, we can do it, but, it's going to look different. And we said, let's go. So that's it. I mean, we realize now that we're in a little bit less restrictive environment. I will tell you, 2 weeks ago, based on the health directives, we didn't feel that it was safe to have a graduation. We feel like it's, we still have lots of risk out there, but if we take the appropriate provisions, we'll be able to lessen that risk.
And when do you expect that kind of full details, families can get full details on what the graduation ceremonies will look like?
Well, what parents are always interested in is what's the date and what's the time of graduation. So we were able to put that out there. I think we've got agreement on that. The full details are yet to come. And, we all know, based on these briefings and as well as what the governor does, that there are changes in the offing, right? So nobody knows what it's going to look like in a week or 2 weeks or about the time of graduation weekend. But and we have to be flexible and with the ability to adjust if in fact we've got a different scenario. But as it stands right now, and I think this is one of the complications with the pandemic, is that when you're talking about school events or the opening of school or graduation or sports or weight rooms or whatever it is, it's very, very difficult to plan quickly. We have to give our folks lead time so that they can do their best work. And so that's our concern. But it looks like right now the dial's going the right way, and we're pretty confident in stating that we can get school reopened, and we're going to do a physical in-person graduation.
And I guess I have a question for Dr. Standish too about reopening school.
Yes.
Yeah, so you talked about limiting density, for the higher grades in the school. Why for those students and not for, the pre-K through 8 students?
So we really started from the place of how can we keep all grades in school with that learning opportunity 100%. But when looking at our high schools and our hallways and the density, keep in mind our high schools that are 110% capacity. We also have harder to keep cohorts of students together at the high school level. There's a lot of mixing. So it came down to scale, size, and density that we'd like to keep in the framework as a tool, knowing this will evolve and change over time as we learn more, as the health department gets new guidance, gives new guidance, as health directives change. We anticipate learning a lot. And so right now we are keeping that option if we're in that high orange that we may need to do a scaled back capacity at the high school level.
And I'll ask this to kind of a similar question. You talked about this being kind of a general framework with more details to come. When, summer will kind of fly by here, when do you expect that parents could get the next update on, as they're kind of preparing to send their kids back to school this year?
We're working kind of topic by topic through reopening plans. So I'm sure you can imagine there are so many details with each topic, whether it be cafeterias, transportation, how students are going to move in hallways, how students are going to be assigned to classes. So we're working through that earnestly. And the first thing we would need to be able to do is give that clear direction to our school leaders. And I can't speak highly enough of our school leaders because they will really then be looking at their everyday practices and protocols and figuring exactly how to make this run in the way that we can help with the risk as much as possible. So we do not have an exact date for release because we are just working through category by category.
And I'll just put my LPS parent hat on for a second and say if there's one thing above all that LPS does well, it's communication. Because, boy, I get phone calls, I get texts, I get emails. When they have an announcement to make, they find parents, and they're committed to doing that because they do want us to be able to have some lead time, and we appreciate that. So thank you. Any other questions before we close out the briefing?
Riley Johnson from the we're going to start with questions for Director Lopez.
All right, all right.
Good afternoon, Riley.
Good afternoon, Pat. What is the status with the various meat packing plant clusters and health?
Outbreak at the Smithfield Crete plant as far as your staff and contact tracers know?
Okay. As far as the Smithfield Crete plant, we have had an increase of about 5 cases in the last week, but Smithfield and Crete is offering testing every day, as I understand it, and speaking with the health director from Public Health Solutions. So it's greatly changed the number of cases that we're seeing, and really that situation, the spread has been really mitigated there.
Have
Your contact tracers to date identified local cases related to the demonstrations and protests held at the end of May?
No, we don't have any that we can say are directly related to the protests.
are your contact
Tracers asking if people have been to those gatherings?
Well, we asked them, so they would be likely to share with us if they'd been out to protests, but we haven't had anybody report that.
And do you, I know you've spoken
Last couple of weeks about the testing turnaround time. Are there any issues that are still remaining in terms of getting results back in a timely manner?
Riley, we're actively working with the Department of Health and Human Services on that in the governor's office, and they've instituted quality improvement planning, and we are able to have daily communication with them. We have seen an improvement in that, but we still continue to monitor to assure that that's an ongoing process improvement in place.
Pat, this is Chris Tucker. I have a question kind of dovetailing off of Riley's. So the contact tracers are asking where the people have been, but not, you don't know of any kind of clusters tied to the recent protests. With the National Guard cases, are those local people or are those outside the county?
The National Guard were local people, and I know that you all know it was in the paper that one of our Lincoln police officers also tested positive for COVID.
Have any more cases been tied back to Lincoln Police?
No, there haven't been any at this point. But you need to know, Chris, that, our officers have been doing everything they can to make sure that they have the correct personal protective equipment on at all times. They've been doing the monitoring that we've recommended to them. We've offered testing to them at the appropriate interval. So we have been and we remain in very close contact with not only our Lincoln police officers, but our sheriff's department and our Guard members who are from our community.
Hi, Pat. This is Bill at 1011.
Hi, Bill.
A question about the positivity rate. I know the week is early, but I'm just noticing it's much higher than last week. Today's rate was 10% something. Last week at this time it was 2%. Just wondering if you have any reasoning or any reason to be concerned.
Bill, not at this point yet. We've been able to get more testing done and more tests available, results to us. So that's part of the change you're seeing. And actually, we were just having a discussion about that earlier this afternoon. So we're continuing to monitor, and I'll give you more of an update and summary on Friday.
Any other questions before we wrap up? All right, well, thank you so much for tuning in. Thank you for learning more about how you can protect yourself and your loved ones in our community. And thanks so much to LPS for joining us for this briefing and sharing more about what we can expect for the future of LPS students in their graduation and upcoming school year. Take care.